Hi everyone. I didn't have much time lately, so and the video was long overdue. So video from the car. Irritability in ADHD. It's an interesting one, and it's a very common one. If we are talking about a child with ADHD, it is very common to see what we call emotional dysregulation. So as I explain it to my patients and their parents, kids with ADHD or neurodivergent traits, they are more likely to feel emotions more strongly, and they find it difficult to regulate them. So it's common to see exaggerated reactions to small triggers, to see irritability and sense of overwhelm, and normally emotions run high. So if your child has ADHD or has just emotional dysregulation, regardless of a diagnosis, the main thing is try and observe what happens in a more detailed way. Try and find a pattern. Try and think about the triggers, because very often working on the triggers can help reducing the emotional dysregulation. Is my child becoming dysregulated because he feels overwhelmed by all the demands he's got? Maybe he's too busy, he's got, he's overscheduled, like it happens many times with the kids these days. Or is it because, I don't know, any reasons? As a parent, you're supposed to be able to stop for a second, analyze the situation, see what's going on, try and find the triggers and work on them. Of course, sometimes that is not enough, and a child psychologist can help with the child itself, depending on the age, working on the emotional regulation. And of course, child psychologists often help parents building the right strategies. On a slightly different example, if we're talking about a child with ADHD on treatment with medication, we can sometimes see irritability as a side effect. So this shouldn't happen. So if your child is on medication and he's irritable, do talk to your doctor, because that is something that needs to be addressed. It's once again important to see if there is a pattern, because your doctor will ask you for it. So is the irritability there randomly? Could be any time of the day. Might be something else, might be the medication. Is the irritability there always towards the end of the day when the child comes back from school, for example? That might be what we call rebound, which is the effect of the medication wearing off. And then you see the symptoms, including the emotional dysregulation, coming back with a vengeance. Is it maybe just in the morning? And that could be some medication. The morning is when you see a peak of the medication being released in the bloodstream. So just a change to a different preparation might help. Or is it that dose is too high for that specific child? And sometimes doses that are subjectively too high can lead to irritability. I hope this helps. I am planning another Q&A at some point soon, a live Q&A on YouTube. So I will let you know once I pick a date.